So I want you to think back to your last doctor's visit. Like, really picture it.
Oh, yeah. The waiting room, the whole deal.
Right, exactly. Did you feel, truly listened to, or did you just feel like another data point being sort of rushed through the standardized protocol?
Like a part on an assembly line.
Yeah, exactly. Just given a test, maybe a pill, and then a massive bill. Because today, for this deep dive, we are unpacking a revolutionary shift in how we approach healthcare.
And it is a necessary shift, honestly.
It really is. We're looking at moving away from this fear-driven, doctor-centered system and actually returning to a truly patient-centered philosophy.
Which is a lot harder than it sounds given our current infrastructure.
Totally. And we've got a massive stack of sources for this deep dive. We are pulling from ancient Ayurvedic texts, historical data on the Crimean War, and specifically the work of Dr. Kadiyali Srivatsa.
Often referred to as Dr. Shri in the literature.
Right. We're looking at excerpts from his books, like the Dr. Maya Holistic Healing Guide and Transform Your Life. Plus, we've got some heavy research papers on antimicrobial resistance and AI protocols.
The antimicrobial resistance stuff is, well, it's honestly terrifying.
It really is. But the mission today is to connect all these dots across basically thousands of years of medical history. We're going to see how the wisdom of an ancient Indian sage, the courage of a Victorian nurse, and a modern doctor's AI innovation are all kind of uniting.
Uniting to essentially save humanity from the post-antibiotic era.
Exactly. Because right now, the current medical system, it's like taking your car to a mechanic who only reads the computer error codes.
Oh, that's a great analogy. They don't even open the hood.
Right. They just plug in the machine, read the code, and charge you. What we're talking about today is sitting down with a mechanic who actually asks you, how does the car feel when you drive it?
Which is exactly what Acharya Charaka was doing over 2,000 years ago.
So let's jump right into that. Who exactly is Acharya Charaka?
So he was this ancient Indian physician. He authored these foundational Ayurvedic texts roughly 2 millennia ago.
2 millennia. So we're talking way before anything resembling modern medicine.
Well, absolutely. But his core philosophy is incredibly relevant right now because Charaka believed that illness must be understood through the person, not just identified as disease.
Okay, so it's not just, oh, you have this specific germ, let's kill it.
Exactly.
Yeah.
He refused to practice medicine as this mechanical process.
Yeah.
He didn't reduce human beings to a set of symptoms to just be coded and discharged.
Which is basically the definition of our modern system.
Right. For Charaka, everything revolved around the patient's constitution, which in Ayurveda is called their prakriti.
Prakriti, okay. And what does that actually mean in practice?
It means understanding their environment, their daily habits, their psychology. Because in his view, two people could present with the exact same symptom.
Like a fever or something.
Yeah, exactly. A fever or joint pain. But for those two different people, that same symptom could mean two entirely different things based on their prakritis.
So treating them exactly the same would be absurd.
Completely absurd. But that is exactly what modern medicine has dangerously normalized. We've completely abandoned that holistic principle.
Because it takes too much time.
Time's a huge factor, yeah. We've also built this system that is entirely institution-centered. It's driven by statistical data, these rigid algorithmic pathways.
And it feels like it's designed to defend against negligence lawsuits rather than actually understand the patient sitting there.
That is the core of it, defensive medicine.
Okay, but I have to push back just a little bit here because, statistics in standard protocols, they do save lives, right? If you're having a heart attack, you want the standard protocol.
Oh, absolutely. Rescue medicine is incredible for acute trauma. If you're in a car crash, you want a modern ER.
Right. So why are the sources so critical of this model then?
Because the system generates this massive mountain of biometric data, but there's almost zero actual understanding. It rewards investigation over insight.
Investigation meaning like ordering a dozen different lab tests.
Exactly, running an MRI, doing blood panels, and then it rewards treatment over prevention. It forces the patient into this totally passive, fearful state where they're just dependent on the institution.
Just waiting to be told what's wrong with them.
Right. There's a great quote in the text from Dr. Srivatsa about this. He says, if Charaka were to look at modern medicine today, he wouldn't even recognize it as medicine.
What would he call it?
He'd call it, quote, bureaucracy with a stethoscope.
Wow. Bureaucracy with a stethoscope. That is, that perfectly captures that feeling of being processed rather than healed.
It really does. And that brings us to the modern figure who's really trying to fix this, Dr. Kadiyali Srivatsa.
Yeah, let's talk about Dr. Shri, because his background is fascinating. It's this wild mix of ancient tradition and modern clinical grind.
It is. He has over 50 years of clinical experience, including 15 years working as a consultant pediatrician in the NHS in the UK.
So he knows the institutional bureaucracy inside and out.
Intimately. But he also comes from this ancient Brahmin lineage in India. His family were essentially priest healers, guardians of knowledge for centuries.
So he's got this dual perspective. He understands the algorithms, but he still has that deep ancestral pull toward true healing.
Exactly. And the sources point to this very specific, incredibly tragic catalyst that basically shattered his faith in the modern rescue medicine model.
Yeah, this part of the reading was really tough. It was back in the winter of 1989, right?
December 1989. It was a cold winter day, and this healthy 14-year-old boy walks into the A&E.
Just a normal, healthy teenager.
Completely healthy. But he had this overwhelming aggressive infection. And despite having the entire modern medical arsenal at their disposal,
The boy died.
he died that very evening, holding Dr. Srivatsa's hand.
Oh, man. That's the kind of thing that fundamentally changes how you see your profession.
It was a paradigm-shifting moment for him. It exposed the devastating potential of infectious diseases and the absolute failure of just relying on rescue medicine.
Waiting at the bottom of the cliff for people to fall off, basically.
Because when it comes to infections, if you wait until the patient is in the ER, the bacteria have already won. And this leads right into his massive warning about the post-antibiotic era.
Right. The absolute elephant in the room, antimicrobial resistance, or AMR. He's been warning about this for like 35 years.
He has, and we are currently looking at a projection that superbugs could kill 10 million people every single year by 2050.
10 million people a year, that's just, the scale of that is almost impossible to comprehend.
It's staggering.
Yeah.
And what's worse is that it's entirely a systemic failure. We did this to ourselves.
Yeah, let's break down how we got here. Because it's not just people not finishing their Z-Pack, right? It's much bigger than that.
Oh, it's so much bigger. The biggest driver is agricultural abuse. To increase profit margins, they just pump massive amounts of antibiotics into livestock.
Not because the animals are sick, but just to fatten chickens up faster.
Exactly. Subtherapeutic dosing. It alters the animal's gut microbiome so they absorb more calories. But it also creates this perfect evolutionary training ground for bacteria.
Just constantly exposing the bacteria to low levels of the drugs, killing the weak ones, and leaving the superbugs to multiply.
Right. And then you have the overprescription on the human side. The data from the COVID-19 pandemic is just wild.
Oh, the COVID stat. I remember reading that in the sources. They noted that 95% of patients presenting with COVID symptoms received antibiotic.
95%. For a viral infection.
Right. Antibiotics do literally nothing against viruses, so why were doctors prescribing them? Just out of sheer panic.
Panic and defensive medicine. You have a patient in respiratory distress. You don't have time to rule out a secondary bacterial infection, so you just throw a broad-spectrum antibiotic at them to cover your liability.
Which brings up that great analogy in Dr. Free's writings, the Jurassic Park analogy.
Yes, that perfectly sums up the hubris of modern medicine.
Our medical scientists were so preoccupied with whether or not they could intervene, they didn't stop to think if they should. We just bombed the microbial world with chemicals without understanding the blowback.
And nature always finds a way. The bacteria mutated. So recognizing this, Dr. Srivatsa realized that the war could no longer be fought inside the hospital.
We had to move upstream.
Exactly. In 1996, he published an article in the BMJ basically begging his colleagues to wake up. He wrote, "The duty of a doctor is to listen to the story of a person."
Bringing Charaka right into the British Medical Journal.
It was a bold move. But his mission became preventing the spread of infection entirely, stopping the reliance on these failing antibiotics before the patient even needs a hospital.
And what's fascinating is that the sources draw this incredible historical parallel here. They compare Dr. Shree's mission to systematize healthcare directly to Florence Nightingale.
Which requires us to completely reframe how we think about Florence Nightingale.
Because history usually just paints her as this romanticized, lady with the lamp, the angel of the Crimea, just softly comforting dying soldiers.
Which is such a disservice to her actual genius. She wasn't just a compassionate nurse. She was a fierce, incredibly brilliant systems pioneer and data scientist.
Oh, yeah. She practically invented modern applied statistics for healthcare.
She really did. When she arrived in the Crimea, she used disciplined observation and statistical pattern recognition. She tracked the data.
And she built that famous Coxsum chart, right? The visual data that proved the soldiers weren't dying from battle wounds.
Exactly. She mathematically proved they were dying from the medical system itself, Poor sanitation, overcrowding, systemic negligence.
The hospital was literally the thing killing them.
Right. So she transformed public health by working upstream of the illness. She fixed the ventilation, the spacing, the sewage. She refused to accept preventable suffering.
And this was all in the pre-antibiotic era. She didn't have miracle drugs.
She had to rely purely on systemic reform.
Mm.
And that is exactly the parallel to Dr. Srivatsa today.
So she changed how the physical institutions operated to save lives.
And Dr. Srivatsa is doing the same thing, but for the post-antibiotic AI era. He's trying to change how individuals respond to their symptoms before they ever enter the congested system.
Because, I mean, think about it. For you listening right now, how often have you felt a little sick, gone to a crowded urgent care waiting room, sat there for 3 hours?
Coughing next to a dozen other sick people.
Exactly, only to be told by a rushed doctor that you just have a minor virus. But in the process, you've exposed yourself to way worse infections.
That is the exact systemic failure that both Nightingale and Srivatsa are fighting. In a post-antibiotic world, that waiting room is a biological hazard.
So we need a way to keep people out of the waiting room unless they truly, absolutely need to be there. And that brings us to the core innovation of the sources we reviewed, the Dr. Maya system.
Yes, Dr. Maya, the culmination of his life's work.
Let's talk about the name first, because it's not just some random tech startup name, it's deeply personal.
It is. Maya is actually the name of his daughter. But it's also a very specific, deliberate acronym.
Medical advice you access, or medical advice you ask.
Right, and the texts emphasize that this is not just a marketing gimmick, it's a clinical and philosophical statement. The goal is to fundamentally democratize healthcare logic.
So how does it actually work? Because most symptom checker apps you find online are basically just panic generators. You type in headache and it tells you to go to the ER immediately.
Because of liability. Standard algorithms are rigid. They spit out a scary diagnosis because they have to cover their legal bases.
Right, they aren't designed to empower the patient. They're designed to protect the app developer from a lawsuit.
Exactly. But Dr. Maya operates completely differently. It returns to that Charaka principle. It listens to the patient's story.
But how does an AI listen to a story?
It doesn't rely on a single symptom. It uses advanced logic to identify a specific triad of 3 color-coded symptoms.
A triad. Okay, why 3?
Because a single symptom, like a fever, could be anything. 2 symptoms narrows it down. But 3 symptoms triangulate the probability space. It maps the clinical reality of the infection safely.
Okay, that makes sense. And then it organizes that output into 4 colors. Let's break down this color-coded triad, starting with red.
Red is straightforward. It indicates a medical emergency or a serious, immediate physiological risk.
So if you get red, you absolutely need rescue medicine. Go to the doctor, go to the ER.
Exactly. The system doesn't try to replace emergency care, it just acts as the filter. Now the next color, blue, is incredibly important for public health.
This is the pandemic prevention color, right?
Yes. Blue indicates a severe infection risk and, crucially, an isolation risk.
So if the AI gives you a blue triad, you are likely highly contagious.
Right. It requires you to act responsibly. The system is explicitly telling you to isolate, stay home, and use remote telehealth. Do not walk into a crowded clinic.
Which, if used widely, would literally break the chain of transmission for superbugs or novel viruses before they ever reach the hospital.
It's the ultimate upstream intervention. Moving down, we have green.
Green means minor, right? Safe to monitor.
Exactly. Moderate concern, but safe to observe at home. Or maybe you just need to consult a nurse practitioner rather than tying up an ER doctor.
And finally, yellow.
Yellow is a mild presentation, the standard aches and pains. The system empowers you to just manage it with a pharmacist or simple self-care.
Red, blue, green, yellow. It takes all the panic out of being sick. But the text gets even deeper into how the AI functions. It says it assesses pulse, voice tone, words, and even the color field, or energetic climate.
This is where it gets really advanced. It's using natural language processing to essentially act as a highly observant physician.
So when it says pulse, it doesn't mean it's physically taking your heart rate.
Right. It means it's analyzing the tempo of your emotion. Are you frantically typing? What's your cadence?
And voice tone, it's listening for the vibration of truth.
If it's a vocal interface, it detects the microtremors of panic or pain. It analyzes your words to map your belief systems and cognitive state.
Because if you're terrified, your immune system is compromised.
Exactly. The AI is designed to give insight before intervention. It calms the user down, recoloring the field until coherence returns before it even gives the medical advice.
That is wild. And to get this out to the people who need it most, they design the Prima kiosk.
Right. Personal, responsive, empowering medical assistance.
Because it's one thing to have a great app, but what if you live in a rural village with no smartphone? What if there's a huge language barrier?
The Prima kiosks are built specifically to break down those disparities. They remove fear, illiteracy, language barriers, and cost.
It's bringing top-tier diagnostic logic into low-income and rural settings. But I have to ask, and this is a massive point of friction, isn't using an AI inherently less human than seeing a doctor?
It seems that way on the surface, but we have to look at the reality of the alternative.
Right.
Traditional doctors are currently forced to act like machines. They have 7 minutes, they look at a screen, they click boxes on a protocol checklist.
They literally don't have the time to be human.
Exactly. Dr. Maya actually restores free will. It doesn't force fear or medicalize every single ache and pain. It logically and calmly tells the user what their symptoms mean.
And by doing that, the sources claim it avoids 60 to 80% of unnecessary hospital visits.
Think about that metric. By absorbing the greens and yellows, it clears the waiting rooms. It saves billions of dollars, reduces cross-infections, and frees up the human doctors.
It frees them up to actually focus on the red emergencies with full human empathy because they aren't totally burnt out.
Precisely. It uses a machine to allow humans to be healers again.
Okay, so this sounds like a massive breakthrough, but the sources also contain a really serious warning, specifically from a ChatGPT assessment about intellectual property and imitators.
Yes, this is a vital part of the discussion.
Yeah.
Because this is so revolutionary, people are copying it.
Setting up unauthorized kiosks, literally stealing the name Maya. And the assessment breaks down why this isn't just a standard copyright dispute. This is incredibly dangerous.
It is a massive threat to public safety, and it all comes down to the cognitive danger to the patients.
Right. Because if you are sick or if your kid is sick and screaming at 2 in the morning, your brain isn't working normally.
Your prefrontal cortex basically shuts down. You are in emotional distress. You do not have the cognitive capacity to distinguish between a validated, clinically developed system and a superficial copycat.
You just see the name Maya, you associate it with help, and you trust it.
But if that fake kiosk lacks the 35 years of clinical reasoning, if it lacks the ethical accountability and the specific triad pattern recognition.
It's going to give the wrong advice.
Exactly. And the consequences of that are catastrophic. It can generate unnecessary fear, sending someone to the ER for a minor issue.
Or worse, it delays life-saving help for a red emergency.
Or it misguides a blue infectious patient, telling them they're fine to go to work, putting the entire community at risk.
That is terrifying. It's basically authorizing a biological vector to spread a pathogen.
Which is why patient-centered care has to be viewed as a sacred duty. Imitation without clinical integrity completely abandons the philosophies of Charaka and Nightingale.
It's treating healthcare like a quick digital cash grab instead of a multi-generational commitment to protecting life.
It really is.
Right.
It introduces chaos into a system that is already hanging by a thread.
So synthesizing everything we've talked about today, the true future of medicine isn't about abandoning the human element for technology.
Not at all.
It's about using technology, specifically an ethically grounded AI like Dr. Maya, to protect human free will.
To prevent the systemic overload that breeds these superbugs.
And to revive that ancient wisdom of treating the whole person.
Moving the point of intervention upstream, out of the crowded hospital, and into the community.
Which brings it all back to you, the listener. True health isn't about surrendering to a fearful, overloaded medical bureaucracy.
It's about transparency. It's about competence.
Taking control of your own wellness upstream, making calm decisions before a crisis hits. And to leave you with something to really mull over, there's a final, highly provocative thought in Dr. Shree's text.
A digital immune system concept. It's brilliant.
Yes. Imagine a future where millions of these validated Prima devices are linked to Maya's field. Not for surveillance, not to harvest your data for ads.
But linked as a shared sentience.
A digital immune system for humanity, where every time a single person is healed or safely guided through an infection, the collective intelligence of the network instantly strengthens.
In that world, disease isn't an enemy to be bombed with failing chemicals.
Right. It's an encrypted message from life asking for translation.
The only question is whether we are finally building the tools to actually listen.
That is the defining question of our time. Thank you for joining us on this deep dive.